Hey, it's Will from Start Training. I'm here today to talk a little bit about ACL rehab. Now, unfortunately, ACL rehab is the most common major knee injury in football and has quite a bit of an effect, obviously, on the individual and the team. So both contact and non-contact can be the cause, particularly with non-contact. If you're looking at your pivoting, your twisting, your change of direction, or your landing, and often it's a combination of either of those. Unfortunately as well, females have a higher risk of ACL rupture. This is partly to do with their strength, their size, their hormones, and their Q angle, which is roughly the angle from the hip to the knee. They're also finding that the youth, so younger age, is also becoming a big risk factor for ACL rupture. The whole rehab process following an ACL graft, so surgery, which is 9 times out of 10 the way ACL is fixed. The other one is the fact that you can live without an ACL if you're not looking at returning to sport. So the whole process can take anywhere between 6 to 9 months for return to sport level. Return to work, it can be much sooner than that. So the stages we roughly go through post-surgery is you've got your range of motion, so that's just getting your movement and your range through your knee back post-surgery. From there, we look at your neuromuscular activation, which is all about just getting all the muscles firing correctly and working together and building that strength at an early stage. From there, we look for building through the stages. So we look for building the strength and the muscle mass back. Moving through the stages of your ADLs, so your activities of daily living, so moving around the house, walking, and all those associated with that. From there, you look at building that strength to return to work. Now, your return to work and your return to like your normal ADLs usually isn't too far apart, but your rate of recovery does depend on the type of surgery and the type of graft that's been used, which is determined by your orthopedic surgeon. From there, we look at return, and if you're keen to, you look at returning to sport. Now, what we look for is at least that 6 to 9 month wait, and research has found that, as you can see, there's a 50% decrease in re-injury risk for every month you wait over the 6 month period and up until about the 9 month period. From there, it's really, really important to make sure that we're stressing and developing that strength to pre-injury, and if not a higher level of strength through that knee and obviously surrounding joints, which we're talking hip and ankle. Now, the reason we stress the importance of completing a correct and thorough rehab program for your knee post ACL surgery is you don't want any re-injury. So you don't want another rupture of the ACL graft. As you're performing your strength and conditioning program or rehab program, as you like to look at it, for the knee, as you're progressing more towards sport, that's where we make the program more intense and more sport specific particularly. So for team sports, a lot of it is multi-directional movements. So we need to make sure that all the muscles are working well together and are strong enough to survive the rigors of your chosen sport. Now, just before returning to sport, it's extremely important to complete a thorough return to sport or return to competition protocol, just assessing all that you need to return to your said sport, because there is about a 4 times more likely risk of re-injury if you aren't cleared through your protocol than if you do clear the protocol. If you're after a little bit more information, there is an article on our website as well. If not, give us a call if you're looking for a bit of advice, program to help with your ACL rehab, or you're looking to return to sport post ACL reconstruction. My name's Will, and I look forward to hearing from you.